EUFOREA is thrilled to be celebrating its second annual CRSwNP Awareness Day, taking place on the 20th of April in Brussels, in Belgium. It's a groundbreaking initiative aiming to improve care for patients with CRSwNP, and we'll discover in this programme why it's a much-needed event. This is EUFOREA News, broadcasting from London. Hello and welcome to EUFOREA News. I'm Dr. David Bull. Chronic rhinosinusitis with nasal polyps, or CRSwNP, is a chronic inflammatory condition of the nose and paranasal sinuses. Symptoms include nasal obstruction, smell dysfunction, continuous nasal discharge, and facial pain, all of which profoundly affect patients' quality of life. Now, improving care of these patients is paramount in EUFOREA'S mission, and the aims of the campaign are simple: to raise awareness of CRSwNP and its comorbidities, including asthma and atopic dermatitis, and to look at its impact on quality of life. It also aims to encourage healthcare professionals to learn more about how they can improve outcomes for patients through improved diagnosis, treatment, and referrals to specialist care. And finally, it aims to educate patients on the symptoms of CRSwNP so that they can then seek appropriate care in the management of their disease. Well, to tell us more about this exciting event, I'm delighted to be joined by Professor Peter Hellings. He is Professor of Otorhinolaryngology and Clinic Head at the Department of Otorhinolaryngology at the University of Leuven in Belgium. He's also founder and chair of EUFOREA. Peter, very good to see you. I have to say, it's a really exciting day, isn't it? Why are these conversations so important?
Thank you, David. Actually, you nicely rephrased all the bothersome symptoms that patients come to seek a solution for when they have chronic sinus disease with or without nasal polyps. And actually, the reason why we now talk about this condition is because we all believe that this disease should not be trivialized. We do realize patients do not die from a condition like chronic sinus disease, but we should not underestimate the burden. And the reason why EUFOREA invests in this Global Awareness Day, bringing to the attention the burden of the disease, is because we try to tackle the problem of the underestimation of the burden of sinus disease. And this underestimation of the burden of sinus disease is actually reflecting the underestimation at level of the patient, at the level of the physician, as well as at level of the healthcare and society even, because patients tend to see us and come to see us for one or two symptoms. They cannot even name their condition, and they come to see us for nasal blockage, loss of smell, and or headaches. And all of a sudden, they then get the label of being diagnosed with chronic sinus disease with or without nasal polyps, and this brings them then to the next level and good care that we try to implement in daily practice with EUFOREA. But the underestimation is also playing a role in the referrals from primary care physicians to the ENT specialists, because there is an average delay of 3 to 5 years between a suspicion of diagnosis of sinus disease and referral to the ENT specialist, who can, with a simple nasal endoscopy, diagnose chronic sinus disease. And last but not least, it is actually a matter of fact that also within our societies and amongst the health policy makers, there is an underestimation of the burden of sinus disease, and therefore we invest a lot of time and energy into bringing the burden of the disease to the attention of the community.
Peter, you've spoken very succinctly there about the unmet needs, and that's really what the Awareness Day tries to address. Now, it's also worth mentioning that EUFOREA has also produced the Chronic Rhinosinusitis Pocket Guide and the treatment algorithm. I know it's the result of many months of hard work. It's been really well received, hasn't it?
Indeed, the reflections and also the feedback that we receive on the Pocket Guide, especially the new treatment algorithm, is overwhelming. Because every single physician can position their patient within the treatment algorithm and have good guidance on the next step and the next therapeutic approach, which is actually wonderful. And the feedback has also been so overwhelmingly positive that several of our colleagues in Europe, and I talk here about Dutch colleagues, Greek colleagues, as well as Spanish colleagues, have already invested a lot of efforts in the translation of this pocket guide and treatment algorithm into Spanish language, into Dutch language, as well as in Greek language. So we are very much excited and also positively encouraged to do better and go further to the next level.
So let me finish by just asking you, what are you hoping to achieve at this year's CRSwNP Awareness Day? What does success look like for you?
The success is mainly linked to the fact that we try to bring to the attention the burden of the disease and that we try to talk about this condition. And one of the major outcomes of this Global Awareness Day in 2023 is that we join forces with several other organizations that all deal with upper respiratory diseases, and that we join forces in bringing to the attention the need of patients to have a disease with a name that they can pronounce. Because at this moment, patients suffering from chronic rhinosinusitis with nasal polyps hardly can remember the name of their condition and can also not communicate about their disease with their physician, nor with their family members, nor peers. So in the end, we try to listen to what patients suggest in the domain of sinusitis with nasal polyps and try to take into account their needs for a simple name that they can use to communicate amongst their peers and with their physician. So if we could already move forward in this field by having a lay language name for this condition, I think the EUFOREA expert panel members and the whole team behind EUFOREA, including the patient advisory board of EUFOREA, would be terribly excited.
Yeah, well, that sounds absolutely wonderful. Thank you very much indeed, Professor Peter Hellings.
Thank you very much, David.
Well, joining me now is Mrs. Tonya Winders. She is president of GAAPP, that's Global Allergy and Airways Patient Platform. Very good to speak to you today. Now, the CRSwNP Awareness Day, I think it's fair to say it's a really innovative event, isn't it? Let me ask you the same question I asked Professor Peter Hellings. Why are these conversations so important to patients?
Well, first and foremost, they're important because so many times this patient community is overlooked. They have spent years cycling through doctor after doctor after doctor with unanswered questions, with symptoms that simply have gone unresolved. And so conversations like this are critical to bring that patient voice forward and to make sure that we get the right treatment to the right patient at the right time with the fewest barriers.
So the CRSwNP Awareness Day is really important, isn't it, for patients? I think for the first time they feel that actually the physicians are actually answering all their questions.
It's true. So many times these patients have had multiple surgeries. They've had multiple years of unresolved symptoms where they can't smell, they can't taste, they're extremely frustrated. I mean, even during COVID, so many of us experienced that type of experience, that symptom of not being able to smell your favorite coffee or taste your favorite food. These are patients who live with those types of symptoms all the time because of their nasal polyps.
So just in terms of the Awareness Day itself, what are you most looking forward to, and what would success look like for you?
So success to us on World Nasal Polyposis Day is really just to heighten that level of awareness, to heighten that level of education for certainly patients, for caregivers, for the general public, for healthcare professionals, and for healthcare policymakers. Because again, if we don't recognize the burden and the importance of this disease, if we don't hear those patient voices loud and clear, then we'll never prioritize things like research, treatments, and access to care.
So just from a personal point of view, is there anything that you particularly are looking forward to?
I always enjoy hearing directly from patients. It always connects to the heart when you hear a patient and their journey and their life struggles, because honestly, that's the thing that connects us all. It's our vulnerabilities, it's our struggles in life, it's how we've overcome those things. And hopefully we'll hear from patients who, again, have gotten access to the right diagnosis, the right treatment, and are on the path to living a much fuller life free from nasal polyps.
And finally, if I may just ask you, why is there a need for organisations like GAAPP and EUFOREA to partner together for initiatives like this CRSwNP Awareness Day?
So many times we only hear from the experts, we only hear from the healthcare professionals. But in this example, we're actually working alongside the healthcare providers and the patient advocacy organization. So we are the experts in our own lived experience of people living with nasal polyps. They are the experts in the science, in the care, in the treatment of individuals living with nasal polyps. So coming together, working collaboratively to really raise awareness and to educate the public is what this is all about.
Well, it's been a great pleasure to talk to you. Thank you very much indeed, Mrs. Tonya Winders.
Thank you.
Well, that's it for this EUFOREA news. Many thanks to my guests, to Professor Peter Hellings and Mrs. Tonya Winders. You can find more information about the CRSwNP Awareness Day at euphorea.eu/letstalkcrs. You can also use that link to check out EUFOREA'S pocket guide for the treatment of CRS. And you can find even more information about EUFOREA and register for the EUFOREA educational events on the euphorea.eu website, where you can also sign up to receive the latest news via email. And don't forget to follow us on social media, on YouTube, on Twitter, on LinkedIn, Instagram and Facebook. Until next time, goodbye.